Hello, thanks for having me in the Spotlight series. Today I am sharing findings from one of my most recent projects looking at the effect of informal care on mental health among adolescents and young people in Australia. A little bit about myself. My name is Ludmila. I am a PhD student and research assistant in the Disability and Health Unit at the Melbourne School of Population and Global Health. My primary supervisor is Tanya King, who has been doing amazing work looking at the impact of unpaid care across many domains. And the focus of my PhD is on the mental health effects of caring in people aged up to 25 years. I am a quantitative researcher, so I'm trying to quantify the magnitude of effect of caring across this group using large population-based data sets. So the aim of the project I am presenting today was to assess the longitudinal changes, this means changes over time in mental health when young people are in different caring categories. We use data of participants from the Household Income and Labor Dynamics, or HILDA survey, who were aged between 15 to 25 years across 20 years of HILDA. Using a validated mental health measure, we calculated within-person mental health differences associated with changes in caring. This means that the analytical model takes each individual's value of mental health score when caring and when not caring, and then calculates the average mental health differences between caring and non-caring observations. In using each participant as their own control, we can account for measured and unmeasured characteristics that may affect this relationship. So our findings are really robust to a type of bias known as confounding. Another aim of the project was to examine whether the mental health effects of young caring varies by the extent of caring activities, so we can identify potential groups of young carers who are at higher risk of poor mental health. So we categorize our observations into 0 hours of care per week, 1 to 19 hours of care per week, and 20 hours of more care of care per week. These are our findings. On average, we found that the mental health of young carers decreased by minus 1.98 points when caring for 1 to 19 hours per week, as opposed to when not caring. And we also saw that these effects almost doubled when caring for 20 hours or more. So the implications of these findings are rather obvious. It means that reducing the number of hours of care could potentially improve the mental health of young carers. And I think that's no secret. Unfortunately, young carers are really harder to reach. So interventions in place may not be achieving this goal. And while we don't know much about the long-term impacts of informal care at this age, we know that mental health in adolescents and youth can set the tone for our mental health over our life course. So we need more evidence to understand potential interventions to mitigate these effects, as well as the best way to identify and connect with young carers so that we can support them through their journey. Another major gap in evidence is that caring data in this type of surveys is not usually collected in people who are younger than 15. So we really need information on school-age children to understand how many of them are carers and how caring affects their well-being. So this takes me to the end of my presentation. My contact details are there. If you want to ask me any question about this project or any of the projects I've been working on, feel free to contact me, and thank you for listening.